Hey guys, what's going on? BFR Tuesday. Just hanging out here in the clinic. So my name's Ed Cara. I'm out of Dallas, Texas, and every Tuesday I do about a 15 to 20 minute question and answer regarding blood flow restriction training. So if you have any questions that you would like to get answered, just go to the chat section in your upper right and then type your message in, and I'd be happy to answer that. And I'll give you a minute or two and give you guys a chance to get those questions in. Any questions? All right, looks like nothing right now. So, you know, I was thinking if nobody had any questions, what I wanted to talk about today. And so I have a case right now where college girl doesn't play college sports, but she's very active, probably works out 6 or 7 days a week, very fit. She's very lean. She's not having her menstrual cycle. And so she's working with an endocrinologist to figure that out. We don't think that she has any eating disorders. Don't think that she has any psychological problems with food or body dysmorphia. She's just lean and she likes to work out. And she doesn't work out that much. Like, you know, she's not like running 40 miles a week, 50 miles a week. She's running 2, 3, 4 miles, and she'll do that, you know, 4 or 5 days a week. Plus she'll do some lifting, plus she'll do a little bit. So although it seems like a lot, it's not over the top a lot. Considering, you know, when I was in college wrestling 1,000 years ago, you know, we were working out 6, 7, 8 hours a day. So she's active for sure. She came to me in July with what was diagnosed by the orthopedic as medial tibial stress syndrome. Didn't look like medial tibial stress syndrome to me. Looked more like a full-blown stress reaction or stress fracture. So I sent her out for imaging, came back bony reaction. So I used BFR with her in a non-weight bearing position in order to improve bone modeling or remodeling. And the way that we did that, and I do a whole class on bony formation for osteoporosis, osteopenia on MedBridge online. So it's an online course through them. So that's, I think it's medbridge.com. And that is treating bone conditions. And that's fractures, that is stress reactions, that is osteoporosis, osteopenia. So I got my patient, and I love her to death. And so we get her through. We start actually returning to running. Took me, you know, 6, 8 weeks, a little less maybe. And then she started to develop. She came in like she was fine. I released her, and she came back in a couple weeks later. It's like, I know I wasn't supposed to run more than 2 miles consecutive days yet. So I only ran 2 miles, did it consecutive days, and the next day I woke up and my quadricep feels like it was really tight. And I'm like, something's weird. Treated it as a soft tissue injury just because I couldn't imagine that 2 miles was enough to stress the bone or overstress the bone. Then I made her take some time off, went non-weight bearing just for a day or two. Still not really much better. This went on for about a week to 10 days. Not that she was coming in, but it was just kind of back and forth via text. Condition started changing a little bit. And last week I said, we got to shut it down. I think that this is a bony reaction in the femur, and that you're just getting symptoms in the quadricep because of this bony reaction. I saw this in a female runner probably 15 years ago, and I misdiagnosed it. So I wasn't going to let that happen again. So we went non-weight bearing for a couple days. She went on crutches. Today she came in, her symptoms were essentially 0. So I think that that's what happened, is that she's very susceptible to this bone stress. And she's working with the endocrinologist. I keep double checking to make sure that we don't have any psychological disorders, eating disorders, body dysmorphia. And I don't think we do. I'm in clear communication with her parents. So how am I going to use BFR with her? So today I did a cellular swelling protocol, which is 5 minutes on, 3 minutes off, 5 minutes on, and a non-weight bearing, trying to create pressure around the limb with the swelling that occurs. And that stress from the swelling will put pressure on the bone and help the bone to heal. In 2 days, when she's, after I've confirmed that the non-weight bearing really helped, I'll have her start walking 20 minutes with the cuffs on the lower limbs to help with aerobic conditioning without doing high intensity exercise, and also with bone remodeling. So BFR, yes, very good for hypertrophy, but I'm using it a lot with stress reactions, possible stress fractures where I haven't gotten the imaging yet, and getting good results. I've also used it before with fractures in the cast. I wonder if I have a picture. I'm going to look for a picture of the cuff on with an upper arm cast, where they thought they were going to have to do surgery because it was a non-union, and we ended up being able to avoid surgery. Let's see if I can find that. So anyway, so BFR, very cool, different components to be able to use, different thought processes with these low intensity loads, and not just for reducing stress on tissue, but also reducing stress on bone. So BFR, bone, BFR, fracture. I don't know if I can find the picture or not. So the class is called Augmenting Bone Repair with BFRT, MedBridge. I don't see it. Sorry, I don't see it, but it's a picture of her. She has a cast up to here, all the way to through the hand, and I'm using the cuffs above it, and we did cellular swelling, just making sure that we don't cause an acute compartment syndrome, because that swelling effect in the limb, and there's nowhere for that cast to go. So I got to just be careful of that. If she started to have some numbness, tingling, I would back off the pressure a bit. But good results, no surgery, back to dance, stuff that she does. So any questions? So think about different ways that you need to use low loads, but you want to increase strength, increase bone, increase repair of tissue, and BFR could be an answer. If you have any questions about those or those protocols, just reach out to me. You can reach me at ed@edlecara.com. And if you have anything that you want me to discuss during these sessions, please let me know. If there are no questions today, I'm going to call it, and I will see you guys next week. Thank you so much.